an owl collection lately too, so we have a lot of fun when we go to antique stores. So our speaker today is Dr. Jessica Jordan. She is a graduate of Mount Marty, did her residency at the University of Minnesota, and is now in family medicine and obstetrics at Sanford Vermillion, and I understand a voice teacher as well. Yeah. Awesome. Well, welcome.
All right, some clarification. I'm not a Mount Marty grad. I went to East Carolina University in North Carolina for my undergraduate. I was an opera major, actually, voice performance. Went back to school, did some prereqs at Mount Marty after traveling the country doing some singing. And I started volunteering in hospice and eventually did some prereqs at Mount Marty and decided I was pretty good at science and applied to medical school. Went to VCOM, so it's Edward Via College of Osteopathic Medicine. Everybody know what a DO is? Yeah? Anybody don't know what a DO is? Cool, all right. So a DO is basically the same thing as an MD, but we get an extra toolkit. So we get 500 extra hours at least of hands-on training to diagnose, treat, and manipulate with our hands. So if you think about the skills of a chiropractor, a massage therapist, and a physical therapist, we sort of pull from all of those places and combine that with our expertise with anatomy, and we do work with our hands, which is pretty cool. But that's the difference. We do the same residencies as MDs do. We get the same jobs where we can work everywhere that an MD does, and we just have a little more training in some specialized areas. I went to residency in Minneapolis at the U, Smiley's Family Medicine Clinic, and specialized there in obstetrics, so I deliver babies here, and gender-affirming care. So I actually moved to Yankton because I have a 3-year-old and I need grandparents around. So we moved back, me and my husband. My kiddo is 3 years old now. And Sanford offered me everything that I wanted in a job, so here I am. So today I want to talk about measles. So I like talking, I like having more of a conversation than talking at a crowd, so please, yell out things, ask questions. What are some things quickly that you know about measles? Contagious, very, yeah. What else?
Deadly.
Deadly, that's right. What did I hear back there? Texas, started in Texas, this most recent outbreak, right? Yeah. Vaccinations are super effective, that's right. Anything else? It's true, many people like not to take vaccinations. That's true, more and more recently. Anything else?
As a kid.
You had measles as a kid? Wow, okay.
Smallpox, we get confused.
That's okay, that's all right. We'll go over what it is, yeah. All right, this.
Is the vaccination mandatory or not?
Say it one more time.
Mandatory?
No vaccinations are mandatory. Vaccinations are heavily recommended by science and the government, and lots of schools do mandate and have few exceptions. So yes and no. No one's gonna hold down a child and give them a measles vaccination, but I might come close. Yeah. Anything else that you can think of? Okay. So, this is Elizabeth Cousins. She's the president and CEO of the United Nations Foundation. And I just thought starting with this quote was important. Plummeting measles vaccination rates should set off every alarm. Tens of millions of children are at risk of this deadly yet entirely preventable disease until we get global vaccination efforts back on track. There's no time to waste. We must work urgently to ensure life-saving vaccines reach every single child. So you guys hit the big things I wanted to make sure everybody knew. Measles is airborne, so it's in the air, very much like COVID, but even more infectious. It's very contagious. I'm going to talk a little more about that in a minute. It's deadly, and it's 97% preventable. So if you get, the MMR is a 2-dose vaccine. If you get one, you are 93% protected. If you get 2, 97%. There's not a lot of things in medical science that can say 97% certain. So let's talk about the timeline. So measles cases in 1962, 469,924 cases in the US. That was the year before the vaccine. In 1963, the measles vaccine was introduced. That's not the vaccine we have now, the MMR. It was the early vaccine. After that, in 1970, we're way down, almost 50,000. And when we get to 2000, only 86 cases. So we've basically eradicated measles in such a short time, like 40 years. That's crazy. 2010, 63, 2021, 49, and this is where things start to change. We had the COVID times, right? 121 cases in 22, 58 in 23, 285 in 2024, and over 1,000 this year. And we're not that far into the year yet. And this is of the 12th of this month. I tried to find updated numbers today, but the latest I could find was the 12th. How many cases have we had in South Dakota? 2. Where are they? Yeah, West River. So Monument Health is the system dealing with that right now. And I recently heard that they're putting in place some visitor prohibitions in their mother and child units. So things are changing in this state. It hasn't made it East River yet, but I think it will. So this is another representation. I like looking at facts like different ways. So this is a graph of reported measles cases from 1962. So that's the first box. So 1963 is the vaccine. And following, you can see the rates plummet. So it's highly effective. And we as a nation did a really, really good job in getting this out to families and children. All right, measles. So you've had measles? Maybe?
I don't know.
Okay. All right. So you have? What were your symptoms?
I was pretty young.
Yeah, do you? Okay. Yeah. So the rash actually happens later. You feel like you have a really bad flu. Yeah, you get a high temperature, maybe 105, a runny nose, maybe some red eye, a cough, and then the rash shows up. And sometimes you get spots on the inside of your cheeks and on the mucosa in your mouth. Not everybody has all of these. Not everybody doesn't even have a rash. But we know that the rash is sort of a timeline marker. So 4 days before the rash appears, a person is contagious. So before they even know they have measles, usually, they're contagious. And after the rash appears, 4 days after that, they're contagious. And any symptoms start 2 weeks after exposure. So you can have someone exposed, and then 2 weeks later, they're somewhere completely different, and they start showing signs. So it's highly difficult to sort of contain. Yes?
I have a question, it seems like it's very much affecting children.
Yes.
Is there an age where you're sort of like in the clear?
No, absolutely not. So we do it for children because it's very dangerous for young children. The vaccination is super effective. But our elderly are more at risk, immunocompromised folks, pregnant folks, they're all at higher risk for serious complications from measles. But good question.
Once you get it, are you immune to it or you can still get it?
Good question. You have formed a little bit of natural immunity if you have had it in the past. But the surest way is the vaccination. And even if you have had measles, you can still be vaccinated. Yeah, good question. Great. I have a whole slide. I'm going to get there. Yeah. So why is it so dangerous? It's the key point is this is super infectious, right? You put 12 people in a room, you put one person with measles in there, It's gonna affect 9 out of 10 people. It's so contagious. So the same thing with COVID, you're gonna infect maybe 2 to 3 in that room. But with measles, it's 9 to 10. So very, very infectious. 1 to 2 kids out of every 1,000 measles cases will pass away. COVID, that's more like 1 every 100,000. So especially vicious with our children. Since 1974, 14 different illnesses we vaccinated against have saved 154 million lives. So that's a ton, but 60% of all of those were saved because of the measles vaccine. Another key point, measles droplets stay in the air for up to 2 hours after a person leaves a room. So it's just hanging out. Complications of measles, you have the illness and people say, oh, it's not a big deal, it's just a flu and a rash. You'll feel better in a couple days. Ear infections, diarrhea, serious pneumonia, most significantly for our very young and elderly, and death. So pretty serious stuff. But the one I am especially scared of is this subacute sclerosing panencephalitis. So let me break that down for you. Subacute just means it doesn't happen right when you get measles. It happens 7-10 years later. Sclerosing means it's affecting the brain. Panencephalitis, it means it's all over the brain. So NPR did a quick segment I just want to play. I think it's like 3 minutes long. Let me see if this works. Oh, I love it when things work. Maybe. Great. All the things. Let me try it again. Okay, not a big deal. I can summarize it. So they talked to a pediatrician that is retired and treated children with measles routinely back in the early days of her career. She told a story of a child that she saw for measles as a baby, and then 7 years later started having symptoms of confusion. At school, she would start losing her way around. She wouldn't know how to make it to her next classroom. And slowly she started to deteriorate. First her mental faculties and then her physical faculties started to deteriorate. So they ruled out everything else and they decided that this was a complication of measles that has been documented in other children. And it's always fatal within a few years after diagnosis. And it's rare and it's progressive. And there's nothing we can do about it. Well, there is something we can do about it, right? We can vaccinate. And that was from NPR, All Things Considered. If you want to listen to the segment, it's a good one. It's really compelling. They have the mother of the child on, and it's just really compelling. So we have the vaccine. The MMR vaccine is what most people receive now worldwide. It contains a vaccine for measles, mumps, and rubella, all very common, or used to be common, childhood illnesses. It confers lifelong immunity with just 2 doses. So, I heard vaccines cause autism. No, they don't. No, they don't. It was one study many years ago that has been disproven and that people hang on to. And I understand, I sort of understand why people want a reason, because they see their child struggling, right? And they want to have something they can hold on to and say, this is why. But we know, even autism organizations say, this is absolutely not the case. All these organizations I list have spoken out very strongly that it has no link. So you might have heard that our Robert F. Kennedy sent vitamin A to Texas to help with the outbreak. It can be helpful to treat measles, but it does nothing to prevent it. So there's no natural thing that you can do besides vaccination or complete isolation. So A lot of concerns around vaccines are, oh, I heard it contains this, I heard it contains this, like mercury, aborted fetuses, things like that. So here's all the ingredients of the MMR vaccine. So it contains a living virus, but very, very weakened, of all three of those, mumps, rubella, and measles. It stabilizes with sorbitol, sucrose, and gelatin. Those are just things that hold it in place. The residual products are found in very, very trace amounts. So the main thing people have a problem with is these proteins from cells used to grow virus, these WI38 cells. Anybody know what those are? No? Okay. I had to remind myself when I was preparing for this, so don't feel bad. WI38 cells were originally taken from a Swedish legally aborted fetus from the lung tissue. And from those cells, they created a huge cell line. So basically what we use now are descendants of those cells. So when someone says, oh, it contains aborted fetus cells, that's incorrect. Some of the earlier vaccines probably maybe did, but now they do not. It's all descendants from that cell line. And it is a very common practice to use cells like that in a lot of medical research. Any questions about that? Yep.
So what's our age limit?
You know, I can't get in his head, but I think he has a lot of built up like stock in this alternative thinking around vaccines. And I think that at this point he can't back down from his claims. I know that he's vaccinated his own children, and that says something. I vaccinated my child on time. Good question, but I don't know what he's thinking.
I just had very few minutes in all this discussion.
Yeah, I try to stay away from politics if I can. I just want to offer you my best medical advice, backed by science. Yeah, but good question. So this current outbreak, we've had outbreaks in the past recently, but this year, under 5 years old is 29%. Is this me? No, okay. 29% under 5 years old for the current outbreak. But the highest numbers are in the 5 to 19 years old range. So that was a little different than I expected. But if you think about it, these are the kids that are in kindergarten. They're in groups, right? So 37% of the current outbreak is in that age group. So 95% of all of the outbreak are in unvaccinated children, or humans. And the age group that is hospitalized the most commonly is, as we would expect, under 5 years old. So, yeah, go ahead.
When we were growing up, it wasn't unusual for our parents to have us sleep with other children
Yeah,
who had measles.
yeah.
I take it-
Like chickenpox parties and measles parties. Yes, yes.
So I take it that is no longer good medicine.
Yeah, please don't do that. Yeah. There is something to be said for natural immunity if there are not better alternatives available, but there are. And I wouldn't risk any child having those serious complications if it were an option. Yeah. There are, yep, go ahead.
Question about, I was told I had both red measles and German measles.
Yeah,
Is there different strains?
good question. So those are different conditions. Yeah. This one is called, is it the rubeola? Or, yeah. But German measles is, remind me, guys, which one it is. Is it rubella? German measles? Hold on. We've got people Googling. Yeah. Think it's rubeola. Okay, good, good. Someone who's actively like preparing for tests on these things. Good job. Yeah.
So the MMR does for both German and.
So rubeola is not in the MMR. So that's it's rubella, measles, and mumps. Yeah. So various people can't get the vaccine, and pregnant people can't. This is a theoretical risk, we think, because we can't experiment on pregnant people. That would not be good. So we hold off on all live vaccines, so vaccines that have live virus in them, because we don't know the effect on the fetus. So immunocompromised people, people undergoing chemotherapy, people with HIV/AIDS that have low CD4 counts, so their immunity cells aren't doing their job very well. Let's see, and any immunosuppressive therapies. So lots of conditions you take immunosuppressive therapies for. So those people are more at risk. And it's why a lot of those patients, everybody make sure they have their vaccines and that they continue to be immune. So your doctor might say, let's check your titers. Let's make sure you're immune to some of these things. And if people have had severe vaccine reactions in the past, it's probably not a good idea for them to get it. And by severe, I mean anaphylaxis, like you can't breathe, not like a rash on your arm, because I would take a rash over measles. So what do we do for these people that can't be vaccinated? We depend on herd immunity. To get to herd immunity, it has to be 94-95% immunity of population. Anybody want to guess where we are as a nation right now? 92, exactly, yeah. So we are not at herd immunity anymore, which is scary for not just measles, but a lot of these contagious diseases that we have vaccines for. So herd immunity just means you're putting distance between a person with infection and a person who cannot be protected by it. The thing that concerns me most over in the clinic is I have these itty-bitty babies that come see me, and they can't get the vaccine until they're a year old. Like if I have unvaccinated people coming in, that puts not just me and the staff members, it puts that baby at risk. Good question. I don't think so. Do you know different? Okay. I don't think so, but I have no reading or evidence to back that up. Yeah, but I do not think so. So this is the percentage vaccinated in the United States. So the blue is they don't give us their information. Less than 90% is the dark orange. We're not quite there yet. We're at 90 to 94%, which is still not great. I'm surprised to see Texas is not in that less than 90, especially since that was where the outbreak started. Yes, sir?
Except you have Houston Circle.
Yeah.
Which is a home to many fine clinics and hospitals. And
yeah.
Where I used to make regular calls.
Yeah, I agree. Yeah, that probably helps.
That's probably why it's that way.
Probably, yeah. The large metropolitan area probably helps a lot. Yeah. And this current outbreak was in, I forget what the community is called, but it's a more primitive leaning, like Amish, but not Amish community, where they traditionally do not get vaccines, and that's where it started. So South Dakota is in like the 90-ish percentile. And this is where our outbreaks are happening. Texas, obviously, and we know that 90+% of the people that are getting measles are directly getting it from this outbreak. I'm seeing the time, and I'm gonna speed along. So we vaccinate people at 12 months of age, and then we do it again at 4 to 6 years old. If there's a baby that's gonna travel internationally, we can give it as early as 6 months. And we do that because we don't want to put them at increased risk outside of the US, where vaccination rates are lower. The 2 doses, you can give them as soon as 28 days later. I tried to find the reasoning of spacing them out. I have a suspicion that it's because to just space the number of immunizations that our kiddos get. So a question I've been getting a lot at the clinic is, do you need a booster? So the answer is probably not. 2 doses of the MMR vaccine give you lifelong immunity. And public health authorities are actually tasked to find people that would be at risk for not being immune. So they will reach out. So for most people, you don't need a booster.
Yeah, when I was in college in the 80s, we had a little outbreak on campus, and I had to get another shot because they said I'd had like the wrong kind when I was a baby.
Oh yeah,
They're different.
there is a different kind from early days. And we do recommend people that got that early vaccine to get the MMR. Yeah, good question.
Okay, so I'm 66 years old, so 60 years ago, first, second, third grade, Jolly School.
Mm-hmm.
Not measles, not smallpox, let's go with chickenpox.
Yeah.
Okay. Did I get measles shots at that time as a kid?
What year was it?
In the mid-60s.
Maybe.
Are those same disease then, today? Am I still good 60 years old with my shot?
That's a good question. I would talk to your doctor and talk about your risk factors, okay? So I would talk to your provider and make sure they think about running a test that checks your titers. But I do not know your specific situation, but good question. Yeah. So if people are very concerned about it, there are tests that we can do to check and make sure that you are immune to these diseases. We don't do it often. Sometimes when people lose their vaccination records, we can run those tests to make sure they are immune, and that's like something commonly we do for USD students. And we end up doing quite a few MMR vaccines because of that.
What would be the risk factors at our age that we should be vaccinated?
Good question. So, so what are your ages? I'm not going to assume your ages.
Well, I'm in my mid-70s.
Okay, all right. So we know as we age and gain more experience and knowledge and expertise on things, right? Our elders have a reduced capability in their immune system. So you have a naturally reduced immune system as you age. So you are more at risk of developing serious complications from measles, things like pneumonia, things like really bad rash, things like that. So, but the main thing I worry about with my elder patients are pneumonias, which can be dangerous, just like it was in COVID. Yeah, it can be pretty bad. Good. Other questions? I like this quote. I vaccinate not only to protect the health of my future, of my wonderful boy, but to protect the vulnerable in my community. All right. What questions do you have for me?
For those of us with medical records for loss,
Yeah.
should we just get a dose of MMR?
It might not be a bad idea. Yeah, if you're not absolutely certain that you were vaccinated appropriately or appropriately for the time, it might not be a bad idea.
Is that available for insurance?
That's a good question. I'll use the language I use for all my patients is you'd have to check with your insurance. Yeah. Yeah.
When you say it's 97% effective, is that after death or
Preventing the virus itself.
any sign?
Any sign. That's right. That's right. We know, which is different from the COVID vaccines, right? The COVID vaccines are good at preventing serious complication from COVID. You'll still get COVID, but you might not die from it. But the MMR vaccine prevents the illness itself.
But, like, the fewer people that are vaccinated brings that percentage down?
So it's a chance in every person. So that person has 97% less chance. It doesn't really take into account the population. It's like,
Okay, but I feel like, you know, you're, right, I mean, I feel like, you know, because there's so many more, less people being vaccinated, I thought, and maybe this is wrong, so I'm vaccinated, Jesse's not.
right.
The chance of my then still getting it, even though I'm vaccinated, is greater. No, that's not true?
Nope.
Okay. I feel like that's sort of the message.
Nope.
There's a chance to be exposed more often.
Yes, you have a chance of being exposed and perhaps carrying the droplets somewhere, but you are protected 97% from this measles. Yeah, good question. Yeah, encourage Jessie to go get her shots. Yeah, good question. Did that make sense though?
Yeah,
Okay. Anything else? No?
So measles do not, those viruses do not communicate.
I do not know about the mutation history of measles. Good question. But I know that it's more likely to mutate the more we let it out in the open. So let's just be safe and not do that.
Considering that as a government, there is no more research on it.
There has not been great research lately because it was so rare. I was talking earlier to our farm student from last year. He was asking about my presentation, and I said, well, I didn't learn a lot about measles in medical school because it was so rare. So in residency, when things started popping up, I had to learn myself quickly. Yeah. Anything else before I let you go? Yeah.
I'm older than these two young stamps.
Yeah.
I think I had measles in about 1950. Would I have had vaccination?
No. No, you would not have.
Should I scurry over to Sanford?
You can if you like. You can if you like. So I would talk about your risk factors, what other illnesses you have, what you have going on in your life, who you are around day to day, because it's not just about you, it's about who your circle is, right? Are you at a high risk to get this disease? Are you at a high risk to have it communicated to you? There's a whole discussion on, like, do we check your titer? Do we just give you the vaccine? Or do I make you find your medical records?
Does it hurt anything?
Doesn't hurt anything. No, doesn't hurt anything. Yeah, you might get, so side effects from vaccines are common, and those are pain at the injection site. You might get a little fever, muscle aches, chills, things like that. But those are usually over in about 24 hours. All right, let's wrap it up there, and thank you so much.
All right, thank you very much. That was really interesting. All right, so thanks to our guests, Lucas, Jonathan, Carly, and Joe. Hope to see you all back here again. We need to do the 50-50.